Welcome to Infocus. I'm Bradley Valenaki. Tonight on the program, we'll look at the COVID-19 response with a particular focus on St John Ambulance and its involvement in the whole response program, also the drive-through testing and the new isolation facility at the Taurama Aquatics Center. So I'm privileged to have with me in the studio the CEO of St John, Matt Cannon. Matt, welcome to the program.
Thank you for having me on the program today.
Yeah, so St John Ambulance has been a key partner of government in the response to COVID-19. How has the response been so far?
Well, the cases, as you know, have fluctuated throughout last year, 2020, and this year we've seen a steep rise in cases around the country, and particularly here in NCD and in Western Province. As you know, 5 cases in January was what we recorded in NCD. In February, 124 cases, and then in March, we've gone well over that. And it's obviously very concerning to many of us.
All right, so the ambulance has been responding to probably around 2 possible scenarios. You have the normal accident and emergencies that you respond to, as well as the COVID-19 exercise. Must be concerning for the first responders, because any case may be a COVID-19 case.
The most common case, the second most common case that we'd be called to attend is respiratory illness. So with COVID now being in the mix, the ambulance officers need to be very alert to the potential that the case that they're responding is COVID related. A simple asthma case could very easily be exacerbated by the presence of COVID-19 in that person. We are, like all healthcare systems, we are trying to balance and manage our normal workload, which is relatively high, with our COVID response as well, because people are still suffering from TB, obstetric emergencies and other conditions that we'd respond to. So it is very much about balancing our emergency ambulance service with the COVID response.
Yeah, now let's talk about the drive-through testing. How has the response been?
We've had great support from the community with the drive-through testing. Overall, we've attended to over 3,500 tests, as I understand. Those people that have come forward, as of late, we are doing public testing only using the rapid testing, which we introduced over the weekend. And now that makes it a convenient, free and quick result for patients to identify positive cases.
So, Matt, you said free. The testing is free, or is it paid for?
We're doing entirely free testing now. We had been assisting people with private testing, particularly when there was a smaller number of cases. We had the resources to facilitate not only free testing through the NCD Health Authority, where we would take the swab and deliver it to the Health Authority for laboratory testing, but we were helping people with private testing for their travel. If people needed to go to Australia or other countries, they needed a result to say that they did not have COVID, and we were helping with that. But as you can see, in the last few weeks, we've become much busier. There's a lot more people coming for testing, so we've refocused the organisation onto providing free public testing for people that are actually sick with COVID. If people need test results for their travel or for their work, we're encouraging them to go to one of the private clinics that are offering that. And that's an important measure so that the public health system, including St John, can focus on providing care for the sick and the needy.
All right, so now that it's free, what about the turnaround time? When do those who turn up for swabbing expect the results back?
That's a very good question. The first part of that question is that we can return a positive result in as little as an hour. It's using a new rapid test that's similar in principle to a pregnancy test, except we take a swab of the mucosal membrane at the back of the throat, and we sample that, and that's taken out and mixed with a chemical, which is then put onto a small testing kit, and we have a result back in as little as 15 minutes, but the whole process may take longer, including queuing up for the testing. And all around the world we're seeing long testing times, especially during surges of cases, spikes of cases, as some people call them, waves. So whilst the test itself takes 15 minutes, the whole process could take about 3 or 4 hours until you've been swabbed and we're able to let you know your result. What we aren't doing is telling people that they're negative. This test isn't to determine negative, it's to determine positive. And that might be confusing for many people, but the test is accurate at identifying positive cases. In the event that we return a not positive, we're sending that swab, a second swab, to the public health system or to the private health system for confirmatory testing.
All right, so the drive-through testing went on for a bit last year and then it stopped. Any reason as to why this stopped, and if the current arrangement may stop or continue? What does the drive-through testing depend entirely on?
There were a small number of people coming forward for testing in around November, December last year and January. Unfortunately, the facility that we were using wasn't available after around January this year. It's now available and we've resumed, and we're focused on keeping that open for the duration of the pandemic, because we're seeing around 200 people per day at present.
You're watching Infocus, more on the other side. This is Infocus. Welcome back. Now, still with me in the studio, Matt Cannon, the CEO of St. John. Matt, now continuing on from our discussions earlier on, we spoke about the drive-through testing. Now, before I forget, there were some incidents with regards to people's vehicles that were parked there for the drive-through testing. Must be concerning for St. John, who is actually running the drive-through testing there.
On Sunday, we saw 2 isolated incidents that occurred where cars were held up and the passengers were attacked in the vehicle. Very disappointing. It's the first time that's ever happened before. We've raised the situation with the Governor's office and also with ACP Wagambi, and the police are now sending mobile squad to be present at the site during those periods. Unfortunately, it happened as vehicles were queued up along the Taurama Road. It's a very disappointing situation. People are coming for healthcare. They shouldn't be attacked on the way.
True. And now, look, there is a new hospital set up within the Taurama Aquatics Center. Tell us about it.
So we've worked with the Department of Health and the NCD Health Authority, and of course Port Moresby General Hospital. They're seeing a growing number of cases. At the moment, I understand there's about 70 patients within Port Moresby General Hospital. That's a hospital, to put it into perspective, with 1,200 beds. So around 5% of the patients or more in the hospital are COVID positive. They're resource intensive in the sense that it's not that because they're infectious, it requires nurses and doctors to don and doff PPE, which can take time. It's difficult to work in a hot, humid environment in PPE. In any environment, it's difficult to work in PPE. So we've worked with Dr. Paki Malumi, the CEO of the hospital, and the Health Authority and NCD, and we're opening up Taurama Aquatics Center to be the primary location for COVID patients to stay while they're recovering. We're anticipating initially St John will provide nursing care, and the medical care for the facility will be overseen by the Port Moresby General Hospital and the NCD Health Authority. We expect that initially we'll take a small number of patients, maybe up to 20 in the first week, this week, and as we continue on, we'll be anticipating more and more patients will be managed in this facility. It's been set up in a way that it can take mild to severe cases with the support of the hospital.
All right, so we understand that hospital will also take in COVID-19 positive cases, health staff basically from Port Moresby.
Yeah, the first patients we're expecting to take in, and we have taken in already some health workers that are COVID positive. When they've got mild conditions or asymptomatic, they're able to assist with potentially assist with providing some basic support to other patients in the facility. It's also a good place for them to be able to isolate away from other people and keeping their home safe.
All right, so Matt, you spoke about St. John's role as taking the sort of healthcare or nursing care in the facility, while the medical aspect of things will be taken care of by doctors from Port Moresby. With the experience of St. John in the past, will there be any volunteers on board to assist?
So we've recruited around 100 casual staff at this stage, staff members that are working, they've volunteered to come forward and work at the facility. We anticipate that will continue to grow as the hospital gets up and running. But all of this is to bring a welcome relief to healthcare workers who have been fighting on the front line of this COVID for the last 12 months. We've been fortunate that there were few cases last year, but we are unfortunately seeing a big surge. And tragically, we're seeing more deaths in the past month, which is terrible for the families of these patients. Some of whom are otherwise well, many of whom were battling other health conditions, but COVID unfortunately has affected them, and it's just a really sad situation. And at the same time, we're seeing healthcare workers, nurses, doctors that are getting tired, that are having to work extended shifts, that are having to work back-to-back shifts, simply because we just don't have enough nurses and doctors here in the country.
Do you think the establishment of the temporary facility at Taurama will actually bring some burden off in terms of bed and spacing for COVID-19?
The hospital to set up there was the initiative of the NCD Health Authority. It's been welcomed by the Port Moresby General Hospital because we anticipate it will ease the pressure on the hospital wards. That now there's about 3 or 4 wards at POMGen that are now being used for the treatment and care of people that have COVID-19 while they recover. The layout of the hospital makes it difficult to manage lots of patients. It also is difficult to manage the infection prevention and control requirements for these patients within the hospital. So this is a partnership between St John Ambulance and Port Moresby General Hospital, with strong leadership coming from the CEO and his team there at POMGen. So this facility at the Taurama Indoor Stadium is an annexure of Port Moresby General, and we're really pleased to be able to partner with Port Moresby General to help with the construction of the indoor parts of the facility, setting up the beds, ensuring that there's medical equipment, ensuring that there's medicines and support services for this facility like catering and cleaning and security.
All right, so this arrangement, is it to cater for only moderate or mild cases or severe cases?
We initially are intending for this to be for mild and potentially moderate patients. However, we're exploring all options at the moment as to whether we need to be considering the facility for higher acuity patients. But this is a decision that will be made by the Port Moresby General and NCD Health Authority COVID-19 team after they've assessed all the options available and making an appropriate decision.
Okay, so the service that's been provided, is this service offered for free by St. John, or is the government taking care of payments for this exercise?
So the hospital is free for patients to stay at. And I think that's important to emphasise. There's no cost to patients. Catering, all these things are being supported. NCD, through Governor's Office, has helped to establish the facility and has put a huge amount of support into getting the facility in a good state that we can take the patients. The Australian government, through Department of Foreign Affairs and Trade, is providing a grant, and that grant is something that as we move through different milestones, as we accept different patients, they're looking at the support that they can provide, and that's been immensely helpful in being able to quickly mobilise without really having too much of an effect on the already busy health system.
Yeah. We'll take a short break now and return with more on the other side. Welcome back to the program. Now, Matt, as a first responder, what are your staff telling you about the COVID-19 situation in the country and especially with the response they're seeing from the individuals they're coming in contact with on a day-to-day basis?
So what we are seeing is, first of all, patients that are presenting with a whole range of severities. So from mild to moderate to severe. What we are seeing is that as the initial symptoms are mild, and we're seeing some patients become more severe and having difficulty breathing. And of course that's a concern for us, and it's a concern for the health system. But overall, we are doing our best to manage the increase in workload associated with these coronavirus patients, but also make sure that our priority has to be equally on continuing normal health services and continuing the normal emergency ambulance services that our teams provide here in East New Britain and in other places around the country.
With the current situation in Papua New Guinea, notably in Port Moresby, should we be worried?
I think it's healthy that we're following the measures that are put in place, hand washing, mask wearing. These are all things that are going to help not only prevent the spread of COVID, but also prevent and reduce the chance of spreading flu, cold, and potentially in some cases even tuberculosis, TB. So these measures are very healthy, things that we should be doing, continuing even when COVID is no longer a threat to our health, even when vaccination is completed and people have had the vaccine. These are measures that help reduce the spread of all sorts of respiratory viruses. But we should be concerned at the moment. I think the health system is being stretched, it is being strained, and from everything from the ambulance to the intensive care ward, we're all feeling the effects of this coronavirus on the community. But it is important that people still come forward for their normal health care and don't be overly concerned about coronavirus when they're seeking health care, because it is very important that you still, for example, have your antenatal appointments if you're pregnant, and have your normal vaccinations for young children. So we are trying to balance our response with also assisting with the coronavirus situation.
All right, so Matt, vaccination, what are your staff telling you? Because government has given the priority to the frontline workers.
Look, and we certainly agree with that. Our staff are at the front line. They're treating coronavirus patients daily. Vaccination, I'm very pleased to say that most of our workforce is supportive of having the vaccination. I certainly am. I've done the research on the vaccination from what the leading health experts and universities have put out, and I'm, as a health professional, I'm confident in the vaccine, and certainly in its safety, but also its efficacy in reducing the chance that you'll get very sick from coronavirus.
Yeah, look, now, apart from Pfizer, we are bringing in the AstraZeneca vaccine in Papua New Guinea. Its cold storage is suitable to Papua New Guinea. I think that's one of the main reasons why we have it in our country right now.
AstraZeneca requires to be stored at the temperature that most normal vaccines that are part of the PNG regime are to be stored at, and so that makes it easier for us to distribute, similar to how we're distributing other vaccines around the country, be it polio, be it hepatitis, be it pertussis, or any of these other vaccines that are recommended.
All right, so I think looking at vaccines, we're a bit behind compared to other Pacific Island countries which are much smaller to Papua New Guinea. That should give us some confidence of taking the vaccine.
Absolutely. This vaccine, and it's important to understand that while it appears to have been developed quickly, coronaviruses have been around a very long time. And researchers for years have been alluding to the fact that the next pandemic that we see could have been a coronavirus. Sadly, they were right. And in this case, the vaccine, coronavirus vaccine, had been worked on by universities many, many years before this new strain of coronavirus came about. This strain of coronavirus, we have tuberculosis bacteria. tuberculosis has different strains. In some parts of the country, we're seeing treatment-resistant tuberculosis. And you've got to think of this new coronavirus, the COVID-19, as a new strain of coronavirus. And that's why it's of great concern, because it's unknown, because it is contagious. But coronaviruses have been around for probably longer than humans have been around. And so the research into coronaviruses has been ongoing for years, if not decades. And that's the reason why the vaccine was able to be produced quickly, and so many of them quickly. But most importantly, vaccines have been studied for decades. And so the safety profile of this vaccine has been examined at length, and the top leading health experts around the country, IMR, MISAC, and the health department, are all supporting the safety and the need for this vaccine. And that's the only reason that it's being allowed to be used here, is because it has the support of the top leading health experts.
All right. So, Matt, last question from me. Look, St. John has been assisting in the whole response. I think because of the budget constraints in the previous 2 years or so, is government offloading some of the funds from COVID-19 to help your organization in its work?
Look, we're getting some support. We haven't had any COVID-19 funding from the PNG government this year at all. We continue to work with government to make sure that the ambulance service is funded, so that we can be in not just Port Moresby, not just Kokopo, but also our priorities for this year are Lae and Kondiawa. But we understand that there are communities that would like to see some more coordination of ambulances in other areas around the country, and where there's an invitation to do that, we're proud to partner with communities to make ambulance and pre-hospital care more readily available.
Look, Matt, we appreciate your time on the program with us, and we thank you. All the best in whatever you do.
Thank you very much for having us today.
Look, we've come to the end of our program, and we appreciate your time with us on the program. If you have comments on tonight's program, you can engage with us social on our Facebook page, or you can watch this program a little later on YouTube. Until next time, stay safe. Bye-bye.